A well-rounded, lifted breast has always been a part of a beautiful woman's description. After pregnancy, women kind of lose this beauty that is associated with their breast. Sometimes there could be emptying of the breast in terms of loss of fat. Sometimes there could be loss of a beautiful, well-defined cleavage. So what do? If you want more information on these aspects, please subscribe our channel, as I am going to elaborately talk about a well-rounded defined breast even after your pregnancy and lactation. During pregnancy, our breasts enlarge to a certain extent to accommodate the extra breast gland tissue, and as a part of lactation, our breast has to give a lot of effort in producing the milk and give the milk to the baby. As a process, there's a lot of fat loss in the breast tissue. So this expanded breast, wherein added with fat loss in the breast tissue, kind of gives a very unpleasant saggy appearance to the whole breast and in combination to the whole body. So none of us like this. The well-defined cleavage that we see before pregnancy is actually lost after pregnancy and lactation. So post-lactation, the most common fat loss happens in the upper pole of the breast, and that gives a very unpleasant appearance when we are trying to fit into our old dresses before pregnancy. So what do we do for this fat loss? Breast corrections after lactation can fall into different categories. Women who have lost the cleavage and the upper pole fat, depending on the type of the breast, we either opt for breast implants or for fat transfer. A completely smaller breast from the beginning with complete fat loss may be a good candidate for a breast implant wherein she needs a complete round upgradation of the volume. Per se, think a woman who had a nice breast before pregnancy or before lactation and she just lost some fat from the upper part of the breast. She might be a good candidate if at all we have to opt for fat transfer. Fat transfer is a procedure wherein we collect some fat after liposuction from your thigh or an abdomen and just fill in those areas which have lost the fat after lactation. So with fat transfer, we can give a more customized appearance to the breast in terms of its look and feel. In fat transfer, especially after lactation, the filling can happen specifically in the cleavage area, and this fills up your cleavage area in a targeted way, giving your round, well-defined cleavage like your pre-pregnancy again back. There is another situation where the woman had a very heavy breast before pregnancy, and this heavy breast has sagged down to varied levels after pregnancy and lactation. So this woman already has a lot of volume. If we give an extra volume, this might not be the actual requirement of the lady. So in these cases, we do a breast reduction with a mastopexy, wherein we remove certain part of the breast tissue and lift the breast up to its original position, tuck it there, and then re-drape the skin over the breast. This again gives a rounded and lifted appearance, and this can be customized with some fat filling around the cleavage area, so to give a nice definition around the cleavage area. If you have any queries on this information, please add your queries in the comment section below. If you like this video, share it to your female friends for whom this video can make a great deal of change in their lives. Subscribe to our channel and press bell icon for notifications.